Our second video is dedicated to highlighting a very special doctor-patient relationship that eventually turned into a relationship between colleagues. The highly regarded and highly skilled medical oncologist, Dr. Sharlene Gill from the Vancouver, BC Cancer Agency, treated Dr. Mary Vera, our epidemiologist, for her stage 3B rectal cancer, prescribing her adjuvant chemo. Mary was just 36 years old when she was diagnosed, 8 months postpartum. Mary's journey inspired her to now be contributing in such a meaningful way to the colorectal cancer community, as she is conducting compelling research in respect of early age onset colorectal cancer and collaborating with Dr. Gill. It's truly an inspirational video. Facilitating the discussion is Ms. Anne-Marie Wright from Unlimited. I invite you to sit back and expect to be inspired once again. Enjoy.
Dr. Sharlene Gill is a professor of medicine at the University of British Columbia and a medical oncologist specializing in gastrointestinal malignancies at BC Cancer in Vancouver. Dr. Gill also has a master's of public health from Harvard and an MBA from the University of North Carolina. Dr. Gill is a valued member of CRAN's Medical and Scientific Advisory Board, wherein she keeps CRAN abreast of the latest developments in the management of colorectal cancer. Dr. Mary Vera is an associate professor at the University of British Columbia's Faculty of Pharmaceutical Sciences, where she holds a Tier 2 Canada Research Chair. As an epidemiologist and health services researcher, she studies patient experiences with diseases and treatments, most particularly in rheumatology and oncology. She too is a member of CRAN's Medical and Scientific Advisory Board. Dr. Vera was diagnosed with young onset colorectal cancer in 2016 at the age of 36. And because of this, she is uniquely able to bring the patient experience to her research. Dr. Gill became Dr. Vera's oncologist. And outside of this deeply personal relationship, they have continued to build a professional relationship centered on Mary's recent research work into young onset colorectal cancer. A great story with two great professionals. I'm going to go to you first, Dr. Gill. Please let me start with you and a question. Can you tell us more about your practice and how you help colorectal cancer patients?
Well, thank you, Anne-Marie. Firstly, I want to thank CRAN for the opportunity to speak with Mary today and sort of share her story. So I'm a GI medical oncologist. My practice is primarily in cancers of the gastrointestinal tract. Colorectal cancer, as we know, is the third leading cause of cancer-related morbidity and mortality in men and women in Canada. So it's the most common cancer that I treat within my practice. I'm based at BC Cancer in Vancouver. So my career involves clinical practice, looking after patients, teaching responsibilities as well through the university and our fellowship programs, and as well as research. I'm actively involved in clinical trials, trying to bring new therapies to the forefront. I chair the GI disease site for the Canadian Cancer Clinical Trials Group, as well as health services research, which is a particular strength within BC Cancer, where we've been very focused on sort of population-based research and evaluating outcomes. And as well, I've done my best. We all play a part in patient advocacy and education. And much of that work I've been doing more recently through the Canadian Association of Medical Oncologists, where I currently serve on the executive and am president-elect for next year. So I see an opportunity in my practice not only to improve the outcomes of the patients I see directly at the bedside, but I think also through research, trying to really advance the science and provide opportunities for better treatments that will give not just my patients, but all patients with colorectal cancer, hopefully more favorable outcomes.
That must be. Did you and Dr. Vera know each other prior to her diagnosis?
Yeah, it's an interesting question. So the first time I met Mary was during the course of her treatment. And it was then, at the time I recognized, what struck me was this is, a young mother facing a difficult diagnosis. I think as an oncologist, we try to focus obviously on maintaining a clear head and offering our patients the sort of the best care possible, but it's impossible not to be affected personally, emotionally at a level when you see a young patient and a patient with a young family, and really empathizing with that circumstance. I mean, I think those stick in our mind, right?
Yes.
So, and then I learned more about her career as a researcher. And my background was in pharmacy. I graduated from the Faculty of Pharmaceutical Sciences many, many years ago, prior to medicine. And so I was like, oh, that's so cool. She's in the Faculty of Pharmacy. And then learned about her work as an epidemiologist. And so it's been a very organic, I think, evolution of our relationship. And I have, grown to greatly admire and, respect Mary for her, resilience and her tenacity and her passion for research.
Dr. De Vera, clearly the early connection was through your diagnosis. So maybe you can tell us the story of your personal journey and how you and Dr. Gill came to be connected.
Sure. So I was diagnosed with colorectal cancer in March 2016. I was 36 at the time and actually 8 months postpartum. And I think, having, as an epidemiologist, as someone who studies disease, you never imagine being someone with disease and then to hear cancer. I want to argue or say that cancer is one of the scariest words one could hear as an individual, and then suddenly you're a patient. So it was really, devastating, especially as a new mother. And then just to look ahead at what was going to be the journey to get to the other side. So I think one of the most, reassuring yet realistic things that was communicated to me, and I'm forever grateful for my team, my healthcare team, was that it's going to be hard, but you're going to make it. So I was glad that they prepared me for that, because that really kind of got me ready, because the treatment was intense. I had 5 weeks of chemo radiation, and then I had surgery. So I had a lower anterior resection to remove the tumor, and then I also had an ileostomy. So that was where I would empty my waist. And then I had 4 months or 8 cycles of FOLFOX chemotherapy. And then, months down the road, I had a reversal of the ileostomy. So I met Dr. Gill through my chemotherapy treatments. And something she said at the introduction really struck me when she said that, I guess, myself presenting as a younger adult, as a woman, as a young mother, I guess that really resonated, or that she doesn't forget that. And it's funny to hear that from her, because I think that showed, because I always felt cared by everybody, but then I think there was an instant connection in terms of I knew she was going to take care of me, because she just didn't see me as a cancer patient. She saw the entire me. She saw that I was a mom. She saw that I was a young woman. And I think that really kind of cemented what I knew was going to be a relationship, in terms of the faith that I was going to have in her, and also the trust that I was going to have that she was going to take the best care of me. So it's nice to hear that from Sharlene.
Yes.
Oh,
yes.
Okay. I'm good. That's very sweet, Mary. Thank you. Yeah, I think, there's the science of medicine and the art of medicine. And I think we hope as clinicians that we practice both expertly and with the right balance. So, it's honestly so humbling to hear Mary say that, because I think I do tend to wear my heart on my sleeve, and that's kind of been something that has, I believe has served me well in caring for my patients. And it is again a fine balance of wanting to impart that kind of, make that connection, but stay focused on the very hard and real task of getting through, treatment that has, real implications and side effects, and so it's a journey. It continues to be a journey. But yeah, I do think, Mary, that I have very clear recollections of so many of our meetings. What you were wearing.
Mary, you know what? I'm so glad you said that, because it's so funny. One of the things that, so I had a meeting with my dean because I had to take a medical leave. So I was on maternity leave, then I had to take a medical leave, and I was only 3 years into my appointment. So here I was thinking about tenure, and then the dean was like, don't worry about it. There's going to be a drop in the bucket. It's like, your only job is to beat this thing. So then I treated it like a job. So I would dress up in full makeup outfits for my appointments. And I always love Dr. Gill, Sharlene, and also my other medical oncologist, Dr. Kennedy, because you always appreciated my outfits, and that made me feel better. I was like, thank you, someone noticed. But it's those little things that make a difference, because you never want to go to the BC Cancer. It's the last place you want to go. But then if you're going to go all dressed up, it's nice to be recognized for it. So thank you.
Yeah, you did very well.
One of those things where, Dr. De Vera, you talked about the anxiety that someone has around when somebody says the word cancer, and being a human, having an emotional, compassionate view of things is, I think, more than half the battle. Would you agree?
Yeah. Absolutely. And yeah, I think, that like, I admire everybody at BC Cancer, because they do a fantastic job of treating the cancer. And I had so much faith, because I also see them doing the research. They're not only treating, they're also at the cutting edge of just coming up with these treatments or evaluating the treatments. So I knew I was in the best care possible. But when Sharlene talked about the art and science, it was really that seeing me as a whole person, whole patient, not just as like someone with cancer, because it really is some of those side effects or the other impacts that cancer has that really does impact us on a day-to-day basis. So for example, I wasn't afraid, again, coming to the comfort of being able to ask Sharlene whatever I need to ask. Now, I wasn't shy to ask about like the things that were happening to my, lack of better words, lady parts, because because of the chemo and the radiation, I had gone into early menopause. So Sharlene facilitated referrals to gynecologic oncologists, so then I could again be taken care of, like the whole of me can be taken care of. So I really appreciate that.